Thank you for staying with us on Channels Television. Welcome to Health News. I am Yomi Otaigbe. November 13, 2014. That was the day the joint health sector unions in Nigeria, a group of health workers unions made up of medical lab scientists, nurses, pharmacists, physiotherapists, among others, embarked on an indefinite strike. About 2 months into the strike, the patients and those seeking medical services in public hospitals around the country remain at the receiving end. Although medical doctors are not on strike and still render skeletal services, the strike by JOHESU is taking its toll on Nigeria's health sector. We'll be looking at some of the protracted issues today on the program. It's been a recurring decimal in Nigeria's health sector. Year 2014 opened with threats of strike and dovetailed into months of industrial action by various health groups in the sector. For 2015, the year rolled in with a carryover of the strike by the joint health sector unions in federal government-owned hospitals. While the union is alleging that the government is withholding salaries of its members as a result of the strike, there's the news that some state chapters may be joining in the industrial action. In a moment, I'll be speaking with one of the officers of JOHESU. I'm now being joined on the program by the Publicity Secretary of the Joint Health Sector Unions, Comrade Ikechukwu Ugwaja. Thank you so much for joining us.
You're welcome.
It's been about 2 months that your members have been on strike. JOHESU have been on strike. What would you say is the state of discussion between JOHESU and the federal government?
This strike, the whole journey towards the strike started from the year 2009. It's about 4 years plus now. And the health sector has not been very conducive, I have to be honest. Well, in the very first place, the unions under JOHESU has never been interested in strike. We have done a lot of things in the past, going through negotiations after negotiations, reaching agreements, signing memorandum and memoranda of agreement with government, first starting with the Minister of Labor and Productivity, the Minister of Health. And when it got beyond them, we sought for attention of the federal government of Nigeria. And then we were granted audience. The negotiation entered into that with the Secretary to the federal government. We had every agreement done. The strike is about the implementation. We're asking for the implementation of the agreements reached.
Okay, you had a meeting. I guess the last one was on December 22nd.
That's right.
Last year.
That's right.
What was the outcome of that meeting?
That meeting was called basically to see the circulars that are supposed to be rolled out and to know whether the 2 months arrears the JOHESU requested for, as it was done to NMOA members, was ready. But then, surprisingly, we got there. There was no circular at all. There was no seriousness on the part of the federal government of Nigeria.
What did the team, the federal government team, come to the table with?
They didn't come to the table with anything. The Minister for Labor and Productivity was not there. That's the supervising minister for the ministry was not there. The Minister for Health was not there. Permanent Secretary for Labor was not there. Permanent Secretary for Health was not there. It was just the Permanent Secretary, the one director from Labor, that chaired the meeting, and eventually nothing was presented concrete. And we said, we were called, we thought we came here to see all these things and then to take them and call off the strike. We are not interested in going on strike. But you see, like we always say, what we have agreed upon, do it. When we are asking for this secularization of all these agreements, before NMA jumped over and got the issue of salary adjustment. You understand? And we said, okay, since you have enough money to pay, fine. It's over 3 years according to the beginning law. After 3-4 years, you can renegotiate.
But is it about what NMA gets, then JOHESU must get?
No, it's not about that. You see, all of us are fishing from the same pond. the fact remains that if you have agreed to do for one, you must. Because this patient we are talking about is a teamwork. Nobody knows it all. You do your work, I do mine. I don't see why you should be paid for yours, and then you don't allow me to take my own.
Okay, you know what? What I understand came out of that meeting was that the federal government team, they came up with a list of the Joint Health Sector Union members, and also the financial implication of the salary adjustment. And they said, okay, we're going to take this to the president. In the meantime, could you call off the strike?
Oh, that is the worst mistake you would expect us to make. Nigeria has gone beyond agreement, and you believe that agreement will be followed. We have done that severally for the past 4 years, and it never fetched us anything. And we discovered that even an MA that had done it severally and insisted on it, they were the one you answered. We that have been, having this remorse, we are dealing with human life.
So this strike, permit me to say, one can say it's also about ego.
It's not anything ego. We are interested in doing our work and getting what you're supposed to get. Remember, because all of us agreed on this.
For all of that you have said, or most of what you have said, in every paragraph you have to say NMA did this.
Yeah, sorry I have to say that. But the fact remains that where there are 5 children belonging to the same parents, if you single one out as most important, what do you think will happen? The others will complain. That's the situation. We are all, doing the same thing. Look at the time of Ebola. Who is more at risk among all health professionals?
Okay, now let's quickly move on here. You've had these meetings, now there's nothing, it seems like nothing is coming out of it. Aside from the issue of the adjustments of salaries, what are the other issues? Quickly, please.
Thank you very much. There are up to 15 points here involved. One is, there are some of them that we have won in court, like the issue of payment of arrears of cohesive skipping. We've won it in court, okay? We are now asking for the remaining, arrears to be paid to the concerned staff. That's one. Two is that the constitution of the board of teaching hospitals and specialist hospitals, okay, should be readjusted, okay, to reduce the lopsidedness of the government, in the constitution of the board. It should include other health professionals. Where there are 15 members in the board, only 2. One is given to a nurse, the other one is given to a pharmacist. The other 13 are occupied by medical doctors. So you find out that there's nothing that will concern other members of the health profession that will see the light of the day.
But does it matter if it is just about, or if it is doctors? Is it not for results to be achieved?
The results should be achieved, but I can assure you, my own is a profession that plays very important role in the life of a patient. If you have to help me, you have to know it more than me. And not that I know it more than you, and you think you have to direct me on what to do about it. It's a profession. I didn't get in there by accident. I had all the training required. I had what it takes to practice that profession. So you should allow me to practice my profession. It has a scheme of service. It is practiced all over in the world, in the health. So it's not a situation where you pose yourself, I'm a doctor.
So it's about competition.
Healthy competition, if you want me to use that word competition with you, I should say it's a healthy one. Because I must do it to prove that I know it better than you. That's the situation. It's not just mere competition that, we are all practicing this. No.
You know what? Some Nigerians see this strike, and perhaps many of its likes, as being insensitive. You are a radiographer.
Yes.
You are on strike now. You've
Yes.
not been to work for about 2 months.
Yes.
How does it make you feel? You see a patient rushed in, maybe an x-ray should be conducted on that person immediately, and you are not there to do this. How does it make you feel?
This is what we've been preventing since 4 years ago. We've realized these things.
No, how does it make you feel?
Personally, I feel bad. But look at the situation where I'm incapacitated. Government is not encouraging me to do my work. Okay? Even if the first thing is that even if an armed robber has to come to my house, shoot me on the leg, and the best thing is just to do give the attention, and if the armed robber happens to be after the cross-counter firing with the police, I got wounded, the fact remains that I must do my work to save the life of the armed robber and let the law take its course. You understand? So it doesn't really impress us. We don't like it that we are not in the office. But then, what are you doing? Must I kill myself before you realize that I am at crossroads? I'm at a very difficult situation to do my work. That's the situation. Let's look at it this way. We have applied all forms, all levels of apathy in this, okay, from beginning. And that's why we continue carrying over from 2009 to 2010 to 2011, 12, 13, up to date. And nothing's still being done. You realize, look, nobody go to the hospital set up today. If not a hospital that has employment of, cleaners, private, company that clean the hospital, everywhere is bushy. Does it, is it good to be in that form?
But
Everybody is
I understand
important.
the government at least met you at some point concerning the consultancy issue.
Yes. Yeah, they met us. Where is the circular? Where is the payment? This time we are talking about implementation and not just agreement. MOU is long overdue. We have gone beyond that.
So where is that middle ground you think JOHESU will meet the government and then there will be a compromise in the interest of every Nigerian or anyone that is seeking medical services in public hospitals?
Fine. Thank you very much. This is one of the things we're asking for. We are asking the government to provide a level playing ground, a kind of conference for all healthcare professionals, doctors and other healthcare professionals, okay, where we now come to a round table and discuss on the way forward in the health sector. You don't assume that doctors know it all. No, it's not true.